we're going to start to work on postural mobility. What does that mean? So earlier videos, we're working on soft tissue mobility using these rolling techniques in the balls to release the muscle tissues back to their normal length. Now we're going to actively open them. So we're going to hold stretches, but staying very active at the same time. Now, you may not know what that sounds like, what that looks like yet, so here we go. So we're going to get into a kneeling position, this first position. Okay, very simple, low lunge. Okay, I'm sure you've seen this in yoga or many other places, but here the advice that I'm going to offer is how active you're going to stay, and I'm going to offer corrective advice as far as like how you should adjust your spine. So very simply, you're going to be in this kneeling position. You're going to shove your hips forward by squeezing this back glute. Okay, and I'm also going to brace my abs by pulling my rib cage down toward my pubic bone a little bit. Okay, so what I'm feeling now is the elongation of my rectus femoris, my psoas, iliacus, little oblique. Okay, and you may feel it lower down in the quad as well. So I'm not relaxing here. As I said, I'm pushing. Okay, I'm squeezing this glute. I'm also staying tall in my shoulders. Now from here, like we've talked about in the breathing before, we're going to breathe deeply into our stomach. Notice stomach inflates, stomach deflates. Now, if you want to intensify this a little bit, very little, very gentle, remember, be aware of how this affects the back as you're going through it. If you're feeling more pain, go gentle. You can step this foot forward, go a little bit deeper, still squeezing this glute, still bracing the abs, same thing, breathing applies. Okay, so we got anterior hip there. Now we're going to move along into the hamstring. So you can use a couple different tools for this. You can use a belt, a band, a yoga strap, and even sticks. I'm just going to show you really quickly with a strap. So with this yoga strap here, I'm going to lay on my back. I'm going to get it right around the sole of my foot. Now, just like everything I've described, we're going to stay super active. So you'll notice that my left leg, my other leg, is super straight and engaged. And then I'm pulling on this leg, okay? Now I'm going to create a nice traction in the hamstring by pulling back towards my face. You'll notice my knee is slightly bent here. We want to start totally locked. So if you got to lower the leg that way, that's fine. Now, for the first few seconds or so, you can take a couple big breaths to try to relax. Okay, from there, we're going to pull quite hard, knee coming into the chest. And you can bend more and more as you go along to try to get that knee into your chest as much as you can. So I'm pulling harder and harder. Then from there, I'm going to try to straighten my leg, keeping it closer to me this time. So I'm reaching a locked out position, pushing that foot away. And then again, I'm cycling back. I pull that knee in towards my chest. You could bend the knee a little bit more. And then try to straighten again. All the way locked out. And what you'll notice over time after you go through this flossing motion, from bending to straightening, is my foot is going to get closer and closer to my face because I'm gaining this active mobility here in my hamstrings. To straighten. Okay, now that's it for the hammies. Now we're going to get into the glutes. Okay, so you don't need any tools for this one. You could just sit in what's called the 90-90 position. So the 90-90 position is going to be here, 90 degrees in my knees, 90 degrees here in my hips, 90 degrees in my front knee. I'm also pulling my foot up towards my shins, not putting my toes down. Okay. From here, I'm going to be really tall in my posture and staying square to this front knee. Okay. Now, some crampiness can be happening back here in the hip. You may feel some weird things in the obliques. Try to bear with it. If you need to shorten the angles a little bit, you can do that or slide the foot in. That's fine. Optimally, you're here in that perfect 90-90. Now from here, once we're square to this knee, we're going to stay tall and we're going to hinge forward over this knee. The most important thing is how flat your spine is here. Okay, so I'm going to hinge forward, bend over this thigh, but my back is staying very flat. This is the activity the active stretching that I was mentioning. You're staying firm, but as you lean forward, you're feeling the stretch in this glute. Sometimes in the hamstring, IT band, but definitely in the glute. And you're just cycling back and forth like that, staying tall, not allowing any rounding of the spine. This would be a poor example. See how far I can go? It's not about how far you can go. With low back pain, passive stretching like that, where you're folding the spine, is generally not a good idea, especially if you have a herniation. So stay active, stay tall. Okay, so we got the glutes, we got the quads, anterior hip, we got the hamstrings. We're gonna do one more, a little bit active, kind of incorporate the upper body posture at the same time. So we're gonna get into a lizard pose, which is not uncommon. Again, if you've done yoga, you've seen this, okay? So what you do is get into a lunge position, kind of similar to what we did before, but this time you're gonna lay your hands down to the ground, okay, on the inside of the forward foot, okay? So this is, of all the poses, probably the most advanced and the most painful, so enjoy it. So now if you need a yoga block or you need like a bench to put your hands on or your elbows on, you can do that, okay? But if you can, put the hands down. Now, as I said, it's not a passive stretch. I'm not just rounding and flopping my chest into the ground. I'm gonna push with my arms to stay active there. I would actually probably go on my fingertips. Now you'll notice that my back, again, is quite flat, okay? It shouldn't be rounded. I'm pulling my shoulder blades back, okay? Poor example, good example. So elevate how you need to. Now from here, we can do a lot of different things, okay? So we're gonna do two different things. First is we're gonna play with lifting our back foot, keeping the back flat. So you don't lift the foot and round or drop your chest. Everything's gotta stay static while lifting that foot. And what's happening there is I'm elongating this quad and hip a little bit more than we did previously. Not to say you're not feeling a ton here in this groin. You are. There's a ton of stretching happening here. But this is the first piece of that active movement. Now from there, we're going to open the upper back and the pecs a little bit by pulling our inside hand up towards the sky. Okay? Big time yoga move here. Push this arm down, pull this hand up, reach up towards the sky. Now I want you to just hold this. Rather than going up and down, you're just going to continue reaching up towards the sky, feeling this opening in the posture, and staying active. So I'm pushing down hard. It's a very active hold. You'll feel it. You're going to get really warm. And we're breathing here. If you need to come down and rest, you may, and then you can go back to that previous one. And you can go back and forth. You can play with this back leg. You can go up. Now, if you're experiencing a bunch of low back pain right now, I wouldn't recommend the rotation. So avoid this if you're in excruciating pain at the moment. If your back's feeling pretty good, you could add the rotation. So I haven't given any recommendations based on time or repetition. You're going to go through these 4 movements though, all today, all within the same cycle, and you're going to try to do these all week, each day. Now, as far as how long you should spend in each of them, you want to do what's appropriate for you. Some are pretty challenging as far as holding yourself there. Your body's going to start to get a little bit warmer and fatigued as you do them. So I would recommend anywhere between 1 and 3 minutes in each of the poses, okay? And they're all active. Remember, you're moving, don't count reps, just be there for a certain amount of time. And I'll see you in the next video.